Hi, beautiful people. How are ya? I hope you're having a great day. Well, as you can tell, I've given up putting makeup on my eyes. It's just become too difficult. But today we're talking about our metabolism and our diet. I mean, we know that what we eat can affect our symptoms. And maybe what is actually affected is our gastrointestinal tract. I have a lot of issues with that. It seems like many people with fibromyalgia do. Do you? I mean, our diet can affect our biochemistry and our metabolism and potentially cause a remission of our symptoms, or at least help us to feel better. The problem is trying to figure out exactly what we need to do to make ourselves feel better, right? Is it truly possible to cause a remission? I mean, remission just means to temporarily help our symptoms. I feel like I've been in a remission a few times where I felt really good, at least in comparison to how I feel when I don't feel so good. I mean, sometimes I think is how I'm affected by stress. Stress is our worst enemy. And when we allow ourselves to be stressed out, that is just a horrific complication and causes our symptoms to be really magnified. I still, after all of these years of having fibro, still struggle with controlling my stress from time to time. I mean, normally I don't even realize that I'm feeling stressed out. I mean, is that how you feel too? Like it's so much a part of our life to have difficulty with feeling stress that I think we just let it just magnify. And that's not good, is it? But dealing with stress also affects our metabolism and whether we're good at controlling how we feel when we're in a stressful situation. And, some of us are much better at it than others. So today, let's just take a look at fibromyalgia and the possibility of the remission of symptoms. Here we go. Fibromyalgia is a chronic, complex disease that affects about 3% of the world's population. We deal with ongoing, chronic, widespread musculoskeletal pain, stiffness, fatigue, allodynia, and hyperalgesia, and many other symptoms. In addition, there's many different overlapping conditions that we might experience, and not all people with fibromyalgia have the same overlapping conditions. It makes it very difficult, I think, for rheumatologists and any other doctor that we might see to figure out what's happening to us. There are conditions that are more widespread among people with fibromyalgia. Some of those conditions are small fiber neuropathy, autoimmune diseases like thyroid issues, migraines or chronic headaches, IBS, dysmenorrhea, depression or anxiety, sleep problems and conditions, ME/CFS, orthostatic hypotension, restless leg syndrome, skin conditions, GERD, arthritis, asthma, food and environmental allergies, multiple chemical sensitivities, back and spinal problems, interstitial cystitis, among so many others. So, what is going on? Why are we experiencing so many issues? Of those issues I just mentioned, I have 12 of 20 of them. And the problem is, if you have one of them, that one could have multiple overlapping conditions related to it. For example, in ME/CFS, you may experience MS, EDS, Lyme disease, Behçet's disease, hypopituitarism, mitochondrial disease, and so many more. So, like I said, what is happening? I am losing my eyesight. I'm young to be experiencing this. I am young, they say, to be experiencing dry advanced age-related macular degeneration or geographic atrophy. But there is a correlation between age-related macular degeneration and fibromyalgia. So maybe it isn't a surprise. And then if you've watched my last two videos on vulvar lichen sclerosis, you know that I was recently diagnosed with that. It's an autoimmune condition that is very painful in certain circumstances and quite scary because it can lead to cancer. I thought I had beat the odds of having an autoimmune condition. Apparently not. I don't know. There was something about turning 65 and now I'm almost 66. I thought, oh, I'm way past getting an autoimmune condition now. I haven't had a biopsy yet of my skin tissue. So, maybe they'll find something different, but I'll keep you informed on that. Comorbidities are very common in fibromyalgia, particularly autoimmune diseases. And some of those diseases are also Hashimoto's, thyroiditis, Sjogren's syndrome, rheumatoid arthritis, MS, and others. The lack of specific biomarkers delays diagnosis and complicates the patient's condition. Thankfully, we don't experience everything all at once. I have days when GERD is an unrelenting problem, or days when IBS just causes me to feel absolutely miserable, and days when I plainly need to relax because of fibro pain, or days when fatigue is just overwhelming. Once again, what is going on? Well, researchers don't quite know. That's the frustrating part, isn't it? What they are saying is that amino acids, fructose, tryptophan, glucose, serotonin, metabolism, mitochondria, neurotransmitter and neural abnormalities, inflammation, microbiota issues, carbohydrates, orthostatic intolerance are all important attributes of what is occurring in fibromyalgia. Because of the complexity of fibromyalgia, researchers from many disciplines are needed. And that also is what makes this so complicated. Rheumatologists, cardiologists, internal medicine doctors, and many others are needed to come together. Just think about this quote. Central sensitization to nociceptive signals and other stimuli is the main accepted mechanism of fibromyalgia. However, many peripheral or systemic changes have also been associated with or suspected in fibromyalgia, such as autonomic nervous system dysfunction, like dysautonomias or orthostatic intolerance, inflammation, changes in muscle function or metabolism, systemic metabolism, or nociceptive input from our muscles. speaking of muscles, many studies have reported that there is an intricate relationship between muscle oxygen saturation and fibromyalgia. The disruption in the oxygenation processes within muscle tissue may be influencing the symptoms of those of us with fibromyalgia. We need oxygen in our muscles for our muscles to function. This may, in fact, affect our ability to move without pain and may also cause muscle stiffness and fatigue. Dysfunction in microcirculation, mitochondrial irregularities, and autonomic nervous system disturbances. Further research on these topics is desperately needed. Now, here's another quote. Mounting evidence indicates that chronic pain is elicited by a decrease in the pain threshold and an increase in the pain response, triggered by an excess of pro-inflammatory mediators. Yes, we know that. Released by infiltrating or resident immune cells and glia that activate or sensitize peripheral nociceptors, unquote. And then there's a 2024 study that discusses our inability to thermoregulate. I've mentioned this probably a few years ago in a video, but really haven't talked about it much lately. Like, I regularly feel like my feet are cold. Once I get moving for my day, my feet will warm up, but I often have that tingling feeling. You know that feeling? And if I sit a bit, they're cold again. Do you feel cold when it shouldn't be cold? Or maybe hot when you shouldn't be hot? Yes. This study observed a correlation between several amino acids in the thermoregulatory process in patients with fibro. This involved tryptophan, methionine, histidine, glutamic acid, tyrosine, and 3-methylhistidine. But so much of these things still need to be confirmed. They're not there yet. That's why they don't know. And then there's mitochondria, our cell building blocks that give us energy, with fatigue being, one of our main symptoms. It's no wonder mitochondria is studied so often and that mitochondrial dysfunction is found, impairment, maybe in the muscles. That's what they're saying. But the research that really gets me excited are those on metabolism or insulin resistance, because I struggle so much with the weight right here in my belly, right? In a 2024 study, researchers found there was a significant association between fibro and insulin resistance, and they think it may play a role in our pathogenesis. The higher the pain, the longer the patient has the disease, they found the higher the score of insulin resistance. What is insulin resistance? Well, let's talk about glucose. It's what gives our body energy, and the body makes glucose from all types of carbohydrates. So glucose is also known as sugar, as well as carbs. Our body responds to us eating carbs and sugar by releasing insulin. That's a hormone to keep our bodies fueled and our blood sugar in a tight range. When blood sugar rises, this stimulates the pancreas to release insulin. We need that. It's what my grandson with type 1 diabetes can't do, but we can. And insulin helps the body to deal with the carbs to bring the blood sugar down. If blood sugar is too low, then we need to eat a carb, a sugar. But if it's too high, we need insulin. In insulin resistance, though, we have an impaired response to insulin hormone, which results in elevated levels of glucose in the blood and A1C levels. This often results in a diagnosis of prediabetes. Maybe it's not quite that high. Mine is often at 5.3. It has hit 5.7, but usually stays just under that, but higher than what they want it to be. But if, they say if your A1C stays higher than 5.7, you'll probably get a diagnosis of prediabetes. But if it gets over 6.4, then you're at risk for diabetes type 2 and metabolic syndrome. So what happens? Our cells aren't properly responding to the communication signals from our insulin. They're not communicating. So does it have to do with mitochondria? Does that have to do with amino acids? Does that have to do with pro-inflammatory mediators? Does that have to do with our muscle oxygen saturation? I mean, you know, that's what they're trying to figure out. But is what is happening in our body related to fructose or tryptophan or glucose or serotonin? Maybe it's the inflammation. Maybe it's our microbiota. Maybe it's too many carbohydrates. Maybe it's from orthostatic intolerance, or maybe it's all connected. So let's talk about our A1C levels. As I said, mine can vary, and I don't know why. I can be eating what I feel is a really perfectly good diet, and my A1C will be 5.7. I'm right there at risk. Or maybe I didn't eat as well as I thought, and it's at 5.3. Still above normal. But what's going on? When researchers compared fibromyalgia levels to age-matched controls, fibromyalgia numbers were not quite normal. Maybe your levels are what they call normal. They're statistically higher than what are age-matched controls, people who are our age who don't have problems with their sugar going up and down. And that is telling researchers that something is going on with our glucose metabolism. Now, I'm really fearful about talking about any medications for diabetes, and so I'm treading very lightly and carefully when reporting what research is saying now. It scares me. So please listen to your doctor. I'm not a medical doctor. I'm just sharing with you what research says. So please listen to your doctor. Sounds good, right? So what the researchers did was treat fibromyalgia patients with metformin, and half of them ended up with no pain at all. And of course, it controlled their sugar levels. But a larger study regarding this phenomenon is needed. So that was a small study. In animal studies, metformin has been shown to reduce pain and sensitivity, improve mood-related behaviors like depression or anxiety, and decrease levels of pro-inflammatory cytokines like IL-1 beta. And I struggle with that IL-1 beta because so much research out there is saying that we don't have a problem with IL-1 beta unless maybe you have temporomandibular joint disorder. It does show up there. So I'm not sure about that one, but metformin influences serotonin and glutamate levels and may be the reason for the positive results that they're finding. I don't know. But, large human studies need to be performed. So, what do you think about all of this? I mean, some days I feel like I'm hanging on by a thread, and other days I'm doing quite well. So, my moods go up and down. I don't know if it has to do with what's going on around me or what, but how are you doing? I send you gentle hugs and support. Love you.